Welcome to Ramsay Healthcare's National Graduate Information Evening. So I would like to extend a warm welcome to all Victorian student nurses and midwives, and also those joining us from other states who are interested in working in Victoria in the future. So my name's Hannah Chilton. I'm the VIC Graduate or VIC Fellowship Coordinator, and I would like to introduce you all to my colleague Carolyn Webb, Maternity Unit Educator at Mitcham Private Hospital. So she joins us too. She's going to be answering questions as well, especially from the maternity stream, but also in regards to our Victorian sites with me. So thanks everyone for joining tonight. We're not going to take up too much time with this presentation. I'm sure you've got lots of questions for me, and we'll finish up with those as a Q&A. So we've got 12 Ramsay healthcare facilities situated in metropolitan Melbourne, and we also have 3 facilities located in regional Victoria. And these facilities range from 30 to 350 beds, and they accommodate a range of specialty areas. We're also excited to announce the build of the Northern Private Hospital located in Epping, which will be established in 2024. So that's 550 beds co-located with the Northern Hospital. So many of you may have actually already attended some of our either regional or metropolitan sites for placement. But just to give you a very short overview, our metro facilities services a range of specialty units, and they vary in size. So some of our larger units or sites include Warringal Private Hospital. Some of you may have heard of this before. It's located next to the Austin Hospital and the Mercy Hospital for Women. It's a 215-bed facility currently with 11 theatres, and it's very exciting because we're actually expanding to accommodate 3 additional levels of patient rooms and another 4 operating suites in the next couple of years. They also currently have an ICU, cardiac specialty unit, as well as a range of other specialty services. We have Peninsula Private Hospital, which is a 344 bed facility. It has a 14-bay emergency department, 11-bed ICU, surgical and obstetric units. We also have the Avenue Hospital located in Windsor, which is a 152-bed specialist surgical and medical hospital with 11 theatres and a HDU. And we obviously have a lot more, but I'm not going to touch on all of them tonight. You're welcome to jump onto our website after this session tonight. We've actually got a list of the facilities with their specialties listed underneath them. And then you can have a little look at those and think, all right, I'm interested in this one, this one, and this one, and this is what I'm going to apply for. To touch base on some of our regional facilities, we've got Murray Valley Private in Wodonga, which is a 32-bed inpatient and outpatient rehab facility. We've got Shepparton Private Hospital, which is an acute care facility offering inpatients medical, surgical, and mental health units. And we also have Wangaratta Private, which is an inpatient and day procedure hospital catering to a number of specialties at that unit as well. So we've got, as you can see, they're kind of all linked together a little bit, not too far from each other, which makes it really easy for training and also for catching up with other graduates, which is really, really nice. Even though we have the virtual platforms these days, I'm still a little bit old school like that. So we take a whole range of graduates throughout our facilities. We take enrolled nurses, registered midwives, double degree streams, allied health professionals, and pharmacy interns as well. Graduates undertaking our 2-year intern and fellowship program in our Victorian hospitals will have the opportunity to consolidate their clinical knowledge, obviously in your foundation year. And then you can extend yourself and specialise and further your clinical knowledge in an area of your choice in your development year. Now, there was a question I did see before about, can we specialise in our first year? Absolutely, you can. We just kind of aim that development year as, okay, now I have my foundation skills. Even if they are in a specialty unit, I've still got my foundation skills. Now, how can I further those on? So Victorian Ramsay facilities cater for obviously the number of specialty areas. We encourage our graduates to explore specialties that interest them during the fellowship program. It's a really good kind of opportunity to kind of try before you buy. Being employed into a unit, obviously going through the process of putting in an application, starting and building up that team environment and that foundation of skills within that specialty is really it takes a lot of dedication. As a fellowship participant or a graduate, you're able to kind of have a little taste test. And if it's not for you, we'll find something that is. So it's really, really nice to be able to do that. And the program is tailored to your needs. So if you find that the area isn't quite right, please do meet with your educator so that we can plan your development year, possibly in another area that suits you better. So I'm always happy to answer any questions that you have around graduate applications or fellowship program options. You will have site educators and site graduate coordinators that you can access, but I am very happy to be emailed or called or set up a Teams meeting one-on-one where we can talk you through opportunities in our program at Ramsay. So please feel free to copy down or take a screenshot of my contact details and reach out if you need anything. I think I've got my email up there. Beautiful. So without wasting too much more of our night, I'm going to hand over to you guys. I can see the chat. I'm just going to shut this sharing so I can see the chat properly. And Carolyn, can you access the chat as well?
Yeah, I'm answering a few.
Oh, wonderful. Okay. So what specializations are available for ENs? How does that differ from RNs? That's a really wonderful question. So there are a huge amount of opportunities for our enrolled nurses. There is really not a great deal of difference in opportunities for our ENs compared to our RNs. Our ENs are able to specialise into a multitude of units, including high acuity units, maternity units, ED. There are lots of different streams available, and just as there are for our registered nurses, which is really exciting and I think a point of difference in the program that we offer here. So which hospitals have opportunities for cardio and emergency nursing? So off the top of my head, now cardiac is a little more challenging because there are more hospitals in Victoria that offer cardiac. Emergency nursing, absolutely Peninsula Private has an ED. The Northern Private will have an ED. Warringal does not have an ED, despite being a very large unit. All hospitals with maternity units function in some capacity like an emergency department because the unit is always open to taking patients in, but they don't function as an emergency department. So as far as cardiac, I know Warringal does, I know that Peninsula Private does, I know the larger sites do, and some of the smaller sites do as well. Okay. Carolyn, do you want to throw some questions at me and I'll tell you, do you want to answer any?
Okay, I can throw some questions at you. So one of the questions is, what is the amount of RN graduates Ramsay Health take in VIC hospitals? So depending on the size of the unit, it's generally about 1 to 2 grads per area.
Per area. And the hospitals will have a multitude of areas. So some hospitals might take 10 grads, some hospitals might take 30 grads. It just depends on their needs as well. We do it on a needs basis. So you know that it's definitely been a challenging time in healthcare over the past years. You have worked through or studied through a pandemic. We are looking for new nurses. All hospitals are looking for new nurses, and we are really wanting to fill and grow our own. So fill those spots with our own staff that we can start as graduates, we can build on their knowledge, and we can train them up in the areas that they're passionate about so that they want to stay and they want to develop their careers within Ramsay. So I would predict this intake, there isn't a limit. There's no limit. It depends on what number of applicants we get and how they fit within our units.
There's a question about positions specifically for Ballura.
Yes.
I'm not sure whether you can answer that one. Given that Ballura is a smaller hospital, isn't it?
Oh yeah, it's a one of our medium sites.
Okay. So there's an applicant asking how many RN positions would there be at Peninsula Private or Ballura. So similar, isn't it? 1 to 2,
Similar.
depending on the size of the units.
Yeah, look, it's really, there's not, we don't cap our graduate intakes. It's not like some hospitals, like say we've got 250 grad positions. It's not like that at Ramsay. We look at our applicants, we look at the quality of our applicants and go, fantastic, look, they're passionate. They've made a really wonderful application. They've put thought into it. They have, they're really excited to go into this sort of area. They've done research at our hospital. They're driven. Great. Let's make a spot for them. So I would encourage you to put a lot of thought into your application and really look at targeting your hospital that you want to apply for and your stream that you want to apply for, and making your cover letter really engaging about that hospital, that unit that you're looking to move into.
Mm-hmm. There's another question also, which we've been getting a lot. Mm-hmm. There's some students that haven't had any placements yet, but technically they're supposed to graduate this year.
Wow. Okay. No placements at all.
No. So, yeah, how do they go about getting placements?
So you can still apply if your projected completion date, your graduation date is coming up. You would need to outline your placement requirements within your application. If you haven't had placements at all, it's unlikely that you're going to be able to fit in that much placement before you start in August. But it doesn't mean that we won't hold on to that application and say, look, you've done a really wonderful application. We're really keen to take you on. What about looking at a February intake, and how can we offer you some placement to try and get you there by this point? So please do make an application. Don't be put off by limited placement opportunities, because everyone's had limited placement opportunities. We take on huge amounts of placement at Ramsay, huge. So we do have some up our sleeve, and we do prioritise our graduates. So if you have made an application, you have outstanding placements. If you're successful, we will push to get you through within our facilities.
Okay. Hannah can clarify this, but generally we have a 0.8 or 4-day week grad program, but we can negotiate 0.6. Is that correct?
Absolutely. So the graduate program is very negotiable. It's about what you want. And about your availability. We like people to consolidate as much as possible. I would be reluctant on employing somebody less than 0.6 in a fellowship position, just purely based on how much you'd be able to consolidate. But if there's, if it fits the hospital, they want to offer you 0.5 and that suits you, then that's fine. You can negotiate that. You don't have to go in saying I'll work a full-time or 0.8. That can be negotiated in your interviews.
Rotations. So, for example, speciality areas like theatre and, say, maternity. In theatre, you might be able to rotate through scrub scout, recovery. What else have I missed out?
So anaesthetics, anaesthetics, recovery, scrub scout, and sometimes day surgery, depending on what the facility offers. So that's your theatre rotations generally. Sometimes, so there is a theatre novice program, a fundamentals program that we run sort of in line with our fellowship program if you want to take on a theatre stream that many of the sites in Victoria offer. In fact, most of them, if not all of them, would put you through this program, and it's something you can talk to your site location more on interview. So that looks at supporting you with extensive supernumerary time. There is some projects involved in it as well, and you can. It's up to the site about what rotations and how many you would have. So you may not necessarily rotate through all 4 areas. You might say, I'm really interested in scrub scout. So can I start in scrub scout, and then in my second rotation, can I move into anaesthetics, or whatever suits you guys? It's about negotiating where your area of passion is.
And for maternity, for example, you rotate through birth suite, postnatal, special care nursery, and also get the opportunity to do CTG clinics. So, there's a lot of scope for getting lots of differing experience in maternity.
Absolutely. And it is a wonderful program. There is a Maternity Fundamentals as well, that's coming out for 2022, I think, halfway through the year. And that will be ready for the 2023 intake as well. And there are many, many upskill courses available to our midwives and also our nurses and ENs working in maternity too. So if you are an EN or an RN and you want to work in maternity, that's an option at Ramsay.
Okay. One of the students is asking, hypothetically, if they wanted to do oncology for their first rotation, but then perhaps that wasn't for them, could they then move to ED?
Of course, absolutely. If you went to, say, for example, Peninsula, or you went to Warringal, you started Warringal and you started doing oncology and you got through the first half a year and you're like, this is just not for me, you may negotiate a second rotation throughout that year. If that wasn't an option, if there was no room to move within that first year, they might want you to consolidate. You might have committed to a 1-year rotation in that area. That sometimes happens. It's up to the sites and you to negotiate that. In your second year development year, absolutely, as a state coordinator, I would reach out to Peninsula and say, look, this grad has really enjoyed working at Warringal, but oncology is not for her. Can we try her in ED or him in ED? That would be absolutely an option.
And if you wanted to go from Melbourne to a country facility, we would try and help facilitate that.
Oh yeah, we have plenty of graduates, even just this last year, who have moved into rural hospitals and interstate as well. Yeah, we can do that throughout your fellowship program. We just coordinate with the educators. You don't need to sit another interview. We just have a chat and set up that transfer.
There's a question about Wodonga. I'm not really familiar with Wodonga and what they have, but I would suggest that you go on to Ramsay Health website, and there's a whole spiel for every hospital on, about each hospital and what they offer, what specialty areas they offer.
I see you've asked about pediatrics as well. We do have a lot of facilities in Victoria that Ramsay does have a lot of pediatrics units. They're often mixed in with our general surgical units. So we do a huge amount of pediatrics at Ramsay.
Yeah. So for example, Mitcham and Waverley private hospitals have a big peds unit, lots of ENT. And then also we have special care nurseries at a lot of our hospitals as well. Yep,
that's right. We were doing an education session for graduates and students and staff on site today for pediatrics and infant and neonatal resuscitation, which was really wonderful. So there are often programs site-based that are run as well to keep you in, your CPD up.
Lots of questions about where can I get help for writing my resume, and
that's actually a really good question. I would probably start with your university. There's often a lot of free, or your TAFE, there's often a lot of free programs or support available for career development, and that's where I would go to first. Ask your library, ask your lecturers, where can I access these sort of free online sort of portals, or you might have a tuition, like it might be included into your final part of your nursing course as well. Sometimes I do give you a little bit of guidance with that. If you're still struggling with your resume, there's lots of online tools that are available to spruce up your resume, heaps.
There's some even really good online websites for interview process of interviews and what questions will be asked and how to answer them.
Yeah.
So there's some really good resources out there. It's just a matter of searching through and finding what works for you. Does Ramsay have any palliative care in Victoria?
I think that's a good question.
Yeah. I know
we're definitely linked in with a lot of palliative care.
Oncology.
We've definitely got oncology. We're one of the biggest cancer service providers nationally. It makes me think that, yes, we do have
it would
palliative
be
care
part
services.
of our general medical.
Yes, I would just have a look on each hospital's description about what they offer. I would be very surprised if it's not available in the units. It would be linked in the community.
How many rotations?
There's a maximum of 2 rotations a year. So we don't like people to rotate more than twice a year. Saying that, things like maternity may have rotations within a maternity unit. So that unit would be counted as one unit, and you might go to antenatal, postnatal, birth suite, cesarean section, or in theatre, you may have a little more opportunity. Day surgery and recovery may be counted as one rotation. So usually we say a maximum of 2 large rotations.
Mm-hmm. And that thanks to Beck, who has said that the ANMF is good for CV and resume writing.
Yes, actually they are. And they also have a lot of online CPD provided for free, if you remember.
And if you're graduating through midwifery, the Australian College of Midwives is a really good resource as well.
Very much so.
What have we got?
Mental health. Oh, absolutely. Can we rotate between mental health and general nursing? Carolyn, you can answer that one.
Yes, we can.
We love it.
You know, it's such a big growing area of nursing, and it's really interesting, mental health. So if you are interested in rotating through mental health, I think it's a really growing, developing area of nursing.
It's so fantastic. And we also have specialty mental health units in Victoria, including a perinatal mental health inpatient unit located at Mitcham Private Hospital, linked in with Francis Perry House and Waverley Private and Peninsula Private. And that's a very specialist unit. And we do accept EN and RN grads into that unit. The RN grads that go through our mental health stream in Victoria are currently linked in with the Alfred Mental Health Program, and we are providing training linked in with that program so that accounts towards your postgrad in mental health. If you'd like to pursue that, that's already, it actually accounts for some of the subjects in your postgrad. So we try to provide opportunities that will lead on to further development if you choose to take that path. If it's not for you, then we can try rotating you into another area.
Yeah, and you can apply for graduates in different states, can't you?
Absolutely, and you can transfer within. So if you wanted to do half here, the first year in Victoria, and you wanted to move up to Queensland for your development year, that's fine. Have a little sunshine.
I think we've nearly answered most of the questions here. Hopefully I haven't left anything out.
Does graduate RN get a rotation in the ICU in the foundation year? Absolutely. If you want to start in ICU, you can start in ICU. We have wonderful supports in ICU, good supernumerary time as well, because it is a specialty. And there is a novice program coming out to help upskill RNs into critical care. Can Ian do a rotation in the emergency department? Yes.
Clarification on the theatre novice program.
So you just need to apply for a theatre streamed fellowship program with Ramsay. So when you apply, you're going to be asked about what hubs, like what areas you'd like to apply for. So if you, for example, wanted to apply for Mitcham Private Hospital, where Carolyn works, you would then apply to the Eastern Hub, and it will list which hospitals that covers. And you can specify that you prefer, your preference would be to go to Mitcham, but you'll be interviewed by the Eastern Hub Educators Group for your group interview. Then you'll be broken off into site-specific one-on-one interviews with the site of your preference. And you will then in the application process, they're going to ask you which stream you would prefer as well. So it might be mental health, it might be midwifery, it might be theatre, it might be general, pediatrics, whatever it is, oncology, ICU, whatever. You might just say, not sure, don't know, want to apply for everything. That's fine too. And then in your interview, where you would just make it clear that, you know, you've really had you've had to think about it, you'd really love to move into the theatre program, you know that you've got a theatre complex at that site, and I'm, you know, that interests me, and I'm really keen on doing the theatre novice or theatre fundamentals program. They're kind of, it's an interchangeable name. So fundamentals in theatre it runs over 18 months, and it's part of that graduate development program, so first and second year.
ICU. What hospitals have ICUs?
Peninsula,
Warringal,
Northern will have it as well. We have HDUs at a lot of our sites though.
Yeah. What are the staffing ratios?
Well, we do safe staffing ratios at Ramsay. So ratios are very set, and I know this is a question that we get a lot in public hospitals. We do safe patients staffing ratios. For example, commonly if you've got quite an acute surgical ward, it's very similar to acute surgical ward in a public hospital. If you've got, for example, in birth suite, Carolyn's birth suite functions with one-on-one midwifery, which is actually better ratios than a public hospital, which are often 2 midwives to 3 labouring women. So it's about providing, assessing the unit's acuity at the time. If you've got a really acute patient that deteriorates, they may become one-on-one. If you've got a really light load of general medical patients that are all kind of ready for discharge, you might have a larger load of 5 or 6. It's really based on safe staffing and patient safety. And we always ask our nurses if they have an increased patient load or things change to escalate it to their nurse unit manager, and we just provide more support.
Okay. More information on the graduate program for RNs, you find that on our website?
Yeah, you can find it on our Ramsay Careers page. It gives you a little bit more information, and there's a video outlining of how you apply and how the program works as well. Oh, radiology nursing. Are there opportunities available for graduate rotation in this area in the Ramsay Health? We have radiology within our Ramsay hospitals. Generally, I think they're external companies that I know of. No, but there are things like cath lab and things like that you can rotate into as well, which are really wonderful streams, and they can be linked in with the cardiac graduate program.
Okay. International students, are they being accepted?
Absolutely. Yep, very welcome.
And career opportunities, e.g. progressing to nurse practitioner.
Yes. You know, Carolyn and I love an upskill. There are so many endless opportunities to advance your skills within this company. I have worked in both public and private hospitals throughout Victoria. I've been at Ramsay for the last 8 years. Carolyn, you've been 12 years at Ramsay, haven't you? Yep. We have both pursued further upskilling and further studies within Ramsay. We're both registered nurses and registered midwives. You can absolutely go on to study a nurse practitioner stream. We have also a stream for prescribing and diagnostics for midwives as well, which is like a midwifery stream of nurse practitioner, so midwife practitioner. And we have lots of different upskill programs for enrolled nurses within Ramsay or externally as well. And we're very we promote, if you'd like to stay as an EN, we can upskill you in a specialty within our hospital. If you'd like to go on and study further and do your undergraduate degree, we can support you doing the EN to RN transition program. So it's completely up to you. We very much value our EN and our RN nurses because we need them both to run the floor successfully. Absolutely.
Clinical placement reports. Is it okay to use midway and final summative reports?
It is. We prefer a summative appraisal because it gives us a more in-depth overview of how your entire placement went, because you're only there for such a short time. It gives us a better idea of how you've completed the placement. We understand placement is tough. We understand that there is lots of barriers to people successfully completing placement and having, everyone's learning on placement. It doesn't have to be perfect. Remember that. To have a perfect report can be really difficult to obtain. It can really be very dependent on so many different factors. Who's doing your report for you? How you're feeling on the day. Did you have a challenging patient load? Did you have a really supportive preceptor? So we understand that not everyone's going to have 100% perfect clinical reports. Put in, be proud of what you have, and understand that you are learning. We expect that.
And we have opportunity for you to apply for scholarships within Ramsay.
Lots.
And we've also affiliated with the Tasmanian University of Tasmania.
Yes, they upskill in almost every area: midwifery, critical care, leadership, management, quality, specializations. So all of the acute settings, all of the different specialties, theatre, everything. They provide upskill programs. We have a strong affiliation with UTAS. They waive a huge amount of fees for Ramsay participants, including on top of your Commonwealth supported place. So it's really wonderful. And they offer scholarships exclusively to Ramsay.
Once you've submitted your application, can you edit it?
No. And you get one. You can apply once. So you can apply it once per stream.
Having completed placements at Ramsay, what's the easiest way to get a referral letter from, I suppose, an educator?
Yeah, ask your educator, ask your clinical facilitator, ask your undergrad coordinator, whoever it is that you've been dealing with on site. Go to them, ask them, say, I'm going to apply for a graduate year. Can I please have a graduate referral letter? If they're not sure what it is, send me an email. I'll send one out to them.
Yep.
And we'll probably take one or two more.
Yeah, I think that's our last
Awesome.
question. I'm pretty sure I haven't missed anything, I hope.
No, that sounds good. Does anyone, you can jump off your mics. Is there anything else we haven't covered yet? I'm just mindful that you've been here for a very long time listening to me all night. You're probably a little bit sick of it and you're ready to have your cup of tea. Oh, all good. Thank you. Okay, beautiful. You happy, Carolyn? There's nothing else you need to add?
Yeah, please, as Hannah said, if you want to ask a question, take yourself off.
I'll hang around just for a minute if anyone needs to ask me a question off, turn their microphone off and ask me a question. But otherwise, thank you all so much for attending tonight. We're looking forward to seeing you at Ramsay in the future. Please reach out if you have any further questions. It's really exciting to start building your career right from the first day. I think we really want to stand out, I guess, by allowing you to go, I know what I want to do, or I want to try everything. It's up to you. Make it about you. Make it what you need to build your career. Okay. All right. Well, I'll see you guys soon, but jump off when you're ready. Anyone else who has any questions, happy to hang back for 5.
Hi.
Hello.
Hi, I think we've got Cheryl. Hi, Cheryl.
I'll mute. I'll wait.
Okay.
No, that's okay. Go ahead, Cheryl.
Oh, you might as well
Thank
go
you.
now, Jasmine, I think. Jasmine?
Thank you. I was just making sure I was being polite and courteous.
Oh, that's good.
I've got a question. I've got dyslexia. I've been able to manage to get halfway through my degree and haven't failed a subject yet.
Excellent.
But it is going to always, it doesn't matter how well I can get my reading and writing up. There's always going to be dyslexia there.
Yep.
Does Ramsay support people that aren't A-grade students, basically, or?
Absolutely. I mean, I think nursing is a trade. Nursing midwifery is a trade. We used to learn in the hospitals. We didn't write essays. We didn't write papers. We're people. We like working with the community. We like working with our team. We communicate in many different ways. Yes, you do need to document, and we need to write down important information and communicate that to our colleagues. But there's no reason why we can't utilize a number of different ways that we can do that. So there's different ways we can document. And if there's something that you find challenging, for example, reading and writing, it's about identifying that and looking at ways that we can support you and which units that you want to pursue and how we can facilitate that. So absolutely, yes.
No, that's okay. Well, yeah, like I use Google and stuff now, whether it be for school or work, you know, if I need the definition of a word that I come across, or whether I need to, you know, spell something that the brain just won't, won't facilitate and stuff. So
absolutely, yes. We welcome your application, and you just let us know how we can help you, because we want we don't want you to feel like you're not going to achieve in an acute care setting. We need nurses. We need wonderful nurses like you who are driven to push through these challenges and complete your course. You know, they're the best nurses.
Thank you.
Yeah, you're welcome. Is it Jasmine next?
Yeah.
Hello. Thank you for all your information today. It's been a great help.
Awesome.
I've got a question in regards to the application process. What can make myself and others stand out to you guys? Obviously, reading the website and your values and beliefs and everything like that's really important. But what are some other key things that I could do to put myself above everybody else?
I know Carolyn will agree with me, because we've read a lot of resumes in our time. What stands out for me personally, and I'll let Carolyn chime in too, is I like to hear a personal story as to why you want to come to a particular site. So why does that site stand out for you? What is it in that site that you are driven by? So maybe you have done your research on the site, you know that there is a perinatal mental health unit, and that's an area that you may have never worked in before, but you are extremely interested in. You've done your own research on what qualities you would need to hold as a nurse to work successfully in that unit. You believe that you have these qualities, and this is how you're going to apply them to your new job there. So I'd like people to stand out by showing that they're interested in that workplace. You know, I want them to stay with me. When they're applying, they have to be driven to want to build their career with my site. What do you reckon, Carolyn?
Definitely. And in the interview process, because it is a bit daunting as well, especially when you've got your group interview, just make sure that you kind of don't sit back, like stand out a little bit, answer some questions, because you probably do know the answers. It can be a bit daunting. But yeah, I like the idea of, you know, telling us a little bit about yourself and why you want to, you know, why you want to work with us, and what part of the job that you're really looking forward to. Yeah.
And you probably know a lot more than what you think you know.
You
as
do.
well. And you're a lot more prepared than what you believe you are.
Yeah.
Don't doubt yourself.
And the last 2 years has been really complex and hard to navigate. And we understand that as well.
Yeah, we take that into account, that you're going to need more support coming out as graduates after a pandemic.
Yeah.
Thank you so much, ladies.
No worries.
Thank you. Come and work with us.
Yeah. Anyone else who's got a quick question before we finish up?
I've got a quick question, if he asks us. You said we were able to do rotations in different hospitals within Australia. I know you guys have hospitals in Europe. Is there any way that we could do rotations there, or?
The pandemic had not allowed this recently, and the development year as part of our fellowship program is a newer thing that we've only introduced recently. So in the past we haven't, but I think Bernie touched on this briefly, but there's no reason why this can't be explored. If somebody's passionate about doing that, I will definitely be very open to exploring all the avenues of transferring internationally. Absolutely.
Awesome. Thank you very much.
No worries.
Sorry,
can we take one more?
Sorry, can I ask one quick question?
Absolutely.
Oh yeah, hi, hello.
Hi.
I just want to ask, for example, I've been reading through the Ramsay website, and I'm aware that in Victoria we have a lot of different hospitals. For example, if I really want to get into Avenue Hospital, I'm really would like to get into, for example, the theatre program, but due to whatever reason they are occupied or they don't have any more vacancies. Is that possible for like Ramsay to give you another offer, for example, in another different settings, for like Mitcham or
Absolutely.
Okay.
Yeah, as long as you're open to it, we would discuss it with you as well. So if you interviewed for the Avenue and the program had been filled and you just missed out, and we would discuss this with you, you're very welcome to say, I'm really happy to take on a position at these other sites as well. And often that's the thing, it might just work out. It's like a jigsaw puzzle, fitting everyone into their preferred rotation, because we don't just go, hey, we're taking this many grads for this hospital, you get this stream, you get this stream, you get this stream. We want to give you what you want. Sometimes it is like a bit of a jigsaw puzzle. So yeah, we do discuss that with you at interview. Are you happy? Is there any other sites that you're interested in, just in case? Yeah, so definitely speak up if you are happy to, during your interview, to look at other sites.
Oh yeah, and another thing is, due to the COVID, we've been a bit lack on our placement, and another thing is, I'm aware that every graduation program they would like to see acute placement experiences, and because I'm from Monash, and we've been having different settings in third year placement, and my current placement will be having during July. That's a bit late for the 2023 intake. So is that possible for me to use my second year?
Yeah, of course. Yeah, we expect it. And a little brief sentence about that in your cover letter or your resume is really helpful. Just saying, I've done a second year acute placement. I have my third year placement coming up at this date. So I've submitted the second year ones instead, and I'm more than happy to update this at your request after my placement. Easy. Some people don't even get their acute placements in third year. Whatever you've got, and whatever you're proud of to put forward, pop it in. That's fine.
Thank you so much.
No worries. All right, so I'm very wary that we've gone 30 minutes over. So I might just leave it there, but please send me an email if you need. I'll pop my email into the chat bar, and if you have any questions, I will get back to you in the next kind of day or two. And I'll put Carolyn's down too, because Carolyn's a maternity unit educator. So if you've got any maternity questions, especially, it can be handy to send it to her as well. So I'll pop that in. Do you have anything more you need to add, Carolyn? To type this in.
Just one last question about Rousson and Rousson.
Yeah,
we're looking into it at the moment, aren't we?
Absolutely, we are looking into it currently. Please keep us on your radar, because that is something we're potentially going to be moving into quite soon. We also are looking at recruiting, if you're a registered nurse who have qualified as an enrolled nurse previously, you can work with us up until your graduate program starts, as well as AINs. If you are a qualified PCA or AIN, there are options available for that too. All right, guys, we'll leave it there. Thank you so much for joining us, and take care, and we'll see you soon for your interviews. Bye.
Thank you so much, guys. You've been
Thank
amazing.
you.
Bye.
Thanks, Carolyn. Bye.
Bye, Hannah.